One TV special report.
If they are not yet members in PhilHealth, we have our partners in the local health insurance offices region-wide to assist them in getting registered in the National Health Insurance Program. So soon, this will be launched and currently under development. Next type of registration is assisted registration, in which if there is difficulty for our fellow Filipinos and PhilHealth members to register themselves, we have services to assist them to register to a Konsulta facility, and this is currently being active. So soon, you can approach your employer, social worker, even the local government units to assist you in getting registered to a Konsulta facility. And these three systems will be soon launched and currently under development for finalization. What is currently active is assisted registration through our local health insurance office and through our PhilHealth Customer Assistance, Relations, and Empowerment staff, or also known as PCARES. So these two offices and staff of ours are on standby to receive referrals from facilities if there are patients who are interested to avail in the Konsulta primary care benefit. So we have now close links and coordination and communication with partner facilities to make it convenient for PhilHealth members and patients to involve in Konsulta. So it is most unfortunate that the PhilHealth Konsulta program was launched during the pandemic, and we have to make alternative and safe measures that is convenient and safe for everyone. So all you need to do is approach Konsulta facilities. They will coordinate with our local health insurance office to get patients registered. And soon, we will be launching our own call center through the PhilHealth Corporate Action Center. So Filipinos and PhilHealth members can call our call centers and get themselves registered. So this is currently under development and will soon be launched. So there are a lot of alternatives for our PhilHealth members and patients and to the general Filipino to get involved in PhilHealth Konsulta. So once they are registered, how will now they avail of the Konsulta benefit? So they simply need to visit the facility and request for an authorization transaction code, or also known as ATC. This authorization transaction code is a pre-authorization process to safeguard the transaction is authorized by both patient and PhilHealth, because patients have autonomy in their decision to get involved in PhilHealth, and PhilHealth would like to document that. So there will be a safe and secure appointment and consultations with PhilHealth Konsulta facilities. Once they have secured the authorization transaction code, either through the facility or our local health insurance office, they can present this to the facility, and the facility is now authorized to open an appointment and consultation with the patient. And all of this will be documented electronically, because PhilHealth is shifting to a more paperless kind of facilities so that we would be more cost effective in operations and at the same time environmentally friendly. At the end of each consultation, health screening and assessment, there is what we call as the ECAS and EPRES. These are two forms that will be accomplished by the facility and the member to document real-time what services that has been rendered, and what is the feedback, or what we call as client satisfaction survey at the end of each consultation. So at the same time, we are able to monitor how are our partner facilities performing, and at the same time render quality services. So this is how the e-press, the electronic prescription slip, looks like, and this is what the e-CAS, the electronic consulta available slip, looks like. So this is both in electronic and manual forms, and we just recently oriented our facilities in how to accomplish this form. So again, to secure the authorization transaction, so currently what is active is through our local health insurance office and our P-Care staff. Soon, all Filipinos and PhilHealth members can secure ATC personally through the internet, which will be launched soon, or calling through our Corporate Action Center or our call center. So for healthcare facilities, how do they engage in the Konsulta program? So before they engage, we must discuss with them why be a Konsulta provider. First, you can help PhilHealth for caring for the health of the people, preventing the occurrence of getting serious disease, and lowering people's health risk and medical costs of lifestyle-related diseases through early detection and management. And also, it increases the market in outpatient services in the Philippines. Currently, the most predominant service in healthcare or market is the inpatient. And we would like to compete with the inpatient with outpatient, because we want in the future that inpatients will be obsolete at an extent, because we have kept you healthy and we have been preventing you from being admitted. And through our engagement in the outpatient market, we help lower the cost of medications, because there is now a competitive atmosphere in the pharmaceuticals. And also, this is to help augment hospitals' outpatient resources. So we would like to call everyone hands on deck in outpatient services and resources. And all of our Konsulta providers will be paid per capita per year. So they will be reimbursed for their efforts. So how do facilities become a Konsulta provider? What was the journey of Tagalogin-ADONA POLYMEDIC and Diagnostic Center in becoming a Konsulta provider? What was Doc Ben and Doc Amy's journey in becoming our partner in this program? So first thing that healthcare facilities can do is conduct a self-assessment. This self-assessment, we have tools that we can provide to facilities so they can assess themselves and measure their capabilities, whether they qualify to give quality service that is being required in the Konsulta program. So once they have already ensured that they are willing and capable, they can now submit their initial application for accreditation by filling up the provider data record and other documentary requirements. And they will also need to pay a corresponding accreditation fee. Their application will be deliberated and being discussed by the accreditation committee in our PhilHealth regional offices. And if there's a recommending approval, we can now give them and issue the certificate of accreditation. 4 easy steps for our partner facilities. So the self-assessment is we would like to measure how their facilities are capable generally. Do they have enough human resources to serve their patients? Do they have doctors, nurses, midwives, and auxiliary staff? Do they have adequate medications and drugs and all of its preparations? And do they have laboratories and diagnostic tests to screen and diagnose their patients? So in summary, these are all the documentary requirements needed for our partner facilities to be engaged in the Consulta program. So as mentioned before, the provider data record, performance commitment, technical documents, non-disclosure agreement, photographs and videos of their facility, because we are still operating in the context of the pandemic, and we do not want our PhilHealth officers spreading the new variants of COVID around the region. And with these documents, a corresponding 2,000 pesos accreditation fee. And then, if their doctors are not yet accredited with PhilHealth, we can assist them in engaging in PhilHealth, especially for new doctors, and these are the documentary requirements. So how much do we reimburse facilities with their services to our patients? So for public facilities, that is 500 pesos per capita per year. For private facilities, such as this one, is 750 pesos per capita per year with addition of co-payments. And in Consulta, there is also involved licensing and accreditation. So the DOH, or the Department of Health, has a sister program like Consulta called the Primary Care Facility Program. So DOH are also setting their standards for facilities and how they become a primary care facility in the outpatient setting. And for PhilHealth, we would like to accredit this type of facilities. But currently, we do not strictly require for facilities to be DOH licensed to be engaged with Consulta. So now is the best time to involve in this program, as long as the facilities are willing and capable. And these are the standards that we would like to assess and evaluate in the facilities. So we would like an upkeep of quality in the aspects of infrastructure, human resource, medicines, laboratories and diagnostic tests, equipment and supplies, health information systems, and documentary standards. So what is the state of Consulta nationwide as of this time? So this is taken from our head office data. As of June 15, 2022, there is a total of 362 Consulta providers nationwide. Most of them are in Region 3A, followed by other regions. So as of last month, there were 10 Consulta providers in Region 10, but I will give you an update later. So who are these Consulta providers in the area? So first, in Misamis Oriental, there are already 8 Consulta providers. Most of them are under one management, the local government unit of Cagayan de Oro, and one Consulta provider in Hingoog City. In the province of Bukidnon, we have already our pioneering, the Municipal Health Office of Maramag. And they are now our prototype Consulta facility for the entire province. In Lanao del Norte, there are already 3, 1 private and 2 public. So we have the Eagles Pharma Health Multi-Specialty Clinic, we have the Rural Health Unit of Tubod and Rural Health Unit of Kapatagan. And now, last but not the least, the most awaited part, I'm happy to announce that we have already now 2 Konsulta providers in Misamis Occidental and pioneered by Dr. Ben and Dr. Amy, the Tagalogin-ADONA POLYMEDIC and Diagnostic Center. And now, we have an addition of the St. Augustine Hospital in Plaridel, which will be orienting them very soon in their operations. So how much Filipinos have already been involved in the Konsulta program? This is taken from our data in our head office. There is currently 346,000 Filipinos registered in the Konsulta program. Most of these registered are in Region 5, and in Region 10, we are still in the 4 digits but progressively growing. So I'm happy to announce, as of July 6, there are already 14 accredited Konsulta facilities region-wide, and 2 of them are here in Misamis Occidental. And as of this morning, 9:35 a.m., there are already 4,111 PhilHealth members registered to Konsulta, and 635 of these came from Tagalogin-ADONA POLYMEDIC and Diagnostic Center. And this facility is one of the fastest growing Konsulta providers in the region. So we would like to have a healthy and safe community. The primary care benefit is the key and most cost-effective strategy for a healthy population. By investing so much in hospitals, we are actually not preventing diseases, but we are just solving problems at the end of the line. But by investing in primary care, we are solving health problems from the cause, from the root, from the start. So, disease prevention and early detection are key to staying healthy and to continue enjoying the things that really matter to you. And for healthcare facilities who are listening right now, be a Konsulta provider. Let us work together to pave a better way for better health. And you can contact our local health insurance office with this information you see in our screen. Daghang salamat sa tanan, maraming salamat po, and thank you very much for your time and attention.
Thank you very much, Dr. Francis. Again, a round of applause to Dr. Francis. Indeed, disease prevention and early detection are key to staying healthy and to continue enjoying the things that really matter to you. Okay, so thank you so much, Doc Francis, sa inyong presentation and for setting the stage for the newest benefit that PhilHealth has to offer to each and every Filipino. Ito po yung the konsultasyong sulit at tama or PhilHealth Konsulta, which in essence is our enhanced and expanded primary care benefit that every Filipino can now enjoy through an accredited Konsulta provider. Okay? So at this point, our media partners, we will now open the press conference. But to start with, I would like to request, in behalf of the panelists, I would like to request a message coming from our very own, the first private Konsulta provider in Region 10. Please help me welcome once again Dr. Amy Tagalogin-ADONA. A round of applause, please.
Hello, Ma'am Merlin Ibanez, the beautiful host of the day. Maayong buntag, media. Dili pwede nga dili ko magpasalamat. Akong pagyukbo sa atong bag-o karon nga Mayor of OZAMIZ City, Mayor Indy Waminal, pagyukbo sa atong bag-o nga Governor Henry Waminal, and the former Congressman of Misamis Occidental, Congressman and now Governor Henry Waminal, and now the former Mayor of OZAMIZ City, Mayor Ando Waminal, and of course, the wife, Attorney Pearl Waminal. Kay kung dili tungod sa usa ka inahan, murag dili gyud mahimo ang tanan. So women are really empowered to do multitasking. Mao gyud ni ang mga babayi, no? Kay very aggressive gyud ang mga babayi. And then I would also like to have this opportunity to extend my enormous gratitude to the President of PhilHealth CEO and President Attorney Giran, Attorney Dante A. Giran, CPA, and the former NBI Director. He was once the pillars of the cabinet members of our President Rodrigo Roa Duterte. Can you please? And with much further ado, I would like to extend my heartfelt gratitude when we were awarded as the first private consulta in Region 10 last March 17, 2022. It was not expected. We just did our part. We just worked. We just focused. We don't compete with others. We compete with ourselves. And thank God, it was a momentous moment. And when God says that you have a mission, then nobody can prevent it. And all positive things will come to you spontaneously, flawlessly, like the Dr. Ami Anti-Aging Center. I would like to give my heartfelt gratitude to our Regional Vice President, the action man of PhilHealth, who was sent by the Lord and who was sent by the President personally to be here in Region 10, not only to serve, but with wholehearted, endless, selfless virtue to be the angel of Region 10. Please stand up to be recognized. Regional Vice President Del Aceron II. And I would like also to recognize our ingon pa si RVP, the dancer and the singer of the Konsulta Chairman, Dr. Francis Ramos. Please stand, Doctor, to be recognized. And the local health unit, PhilHealth, the beautiful, and my sister in my maternal sister or fraternal in masonry, Mrs. Fedzi Gomilia. Thank you, sister. And the executive assistant of PhilHealth, my good friend, a spokesperson of PhilHealth, the tall, dark, and handsome, Sir Patrick Peña Randa from Iligan City. And I would like also to give my respect to my sister, Ma'am Delia Rosal. Kabaluka, you are always my idol. I am a member of the Bukagan Hill. Nadugay na jud ko wa kaadto, pero whenever you say something, I will always place that in my heart because you are my idol sister sa fraternity. And all the media, my partner in unsa nadok during our lakwatsa og tabang, Ma'am Tata Rojas. My partners, One TV, Manuel, and other media partners, ug akong mga amiga si Ma'am Tina, Ma'am sa PhilHealth Region 10, si Ma'am Daisy, ug tanan nga naa diri karon, pero dili pud nako pwede kalimtan ang akong pamilya. Dili ko pwede nga mahimong last ang akong husband, Dr. Benny, because I don't believe with the saying that you have to save the best for last. Because the best will always be the first. Dr. Benny Adona, the former Provincial Health Officer 2 of Misamis Occidental, thank you that you are retired already. Thank you for being with me. Thank you for loving us because you have sacrificed your government service for the family. And I would like also to thank Governor Philip Tan for giving my husband the opportunity to serve Misamis Occidental, and Mayor Jenny and all the board members of Misamis Occidental. So I would like also to give my thanks to my children, Dr. Brian Iser Adona, Dr. Athena Berelti Adona, and my son-in-law, Dr. Christian Andre Evangelista Gantuangco, who happened to be having a hospital also in Kidapawan and happened to be the pamangkin of our #1 Senator, Robin Padilla. So salamat kayo ninyo tanan, but isagyod nga nakatabang sa among konsulta is our staff. Without them, this may not be possible. First and foremost, our nurses. Kay grabe na gyud kaayo ang brain drain karon. Halos anang nurses nangawala na. But they work hard together. They stay here for the common good. Ang among nurses karon si Ma'am Jessa, amo ang nursing attendant si Ma'am Hani, ang new registered nurse si Jill Pipanya, si Ma'am Janet Uy, 5 years, 6 years na namo, ang medtech Miss Justine de la Vega, ang among radtech Ma'am Princess, ang hospital administrator Marlon Talaba, and our HR, my sister Nona Saulong, and our accountant Noel Neri. So, meaning to say that we cannot move without a concerted effort of everyone. And I believe, and I have faith in my heart, that this program of PhilHealth will be the next health care that all Filipinos, that this is not only, meaning to say, there may come a time that health must cease to be a privilege to the few and be the right to all the Filipinos. Meaning to say, dili lang mga dato ang pwede magpatambal. From the poor to the poorest, pwede na ta magpatambal. That's why I am very inspired with all my heart that primary health care is the benchmark and the cornerstone of healthcare. And I believe that the konsulta is the role of the community, that we have to take care of each other. That we, each and every one of us, ikaw Sir Manuel, ikaw Sir from One TV, PhilHealth, ako, si Dr. Adona, si Sister Delia, we all have the right to our health. Naatay basic right, naatay katungod na magpatambal. And this konsulta is an inspiration to all doctors, that doctors are the guardians, that doctors in the primary health care, we are the primary providers that shepherded and navigate all patients in order to guide them on what to do and refer them to specialists in order to have the best quality and standard of care. That there may come a time that there is a result that will ingrained in our culture that prevention and preparation is second to none. Moabot ang panahon nga dili nata magkasakit. Moabot ang panahon with the program of PhilHealth that I am mesmerized, inspired, that primary health care is the living witness that health is wealth. And primary health care is an ounce of prevention better than a pound of cure. And Dr. Francis Ramos and our RVP Del Asaron have reiterated that all Filipinos must have the right to know the basic of PhilHealth, that we prevent before we heal. We are just an infirmary hospital. We have a 25-bed capacity, but we have a pharmacy, a competent staff. Our IT is Ma'am Christian Dylan Rios. Ang cipher na gidownload sa PhilHealth, wala kaayo na guide because tungod sa pandemic, but she made it. I am very proud of my staff that they work together as one from their hearts. Maunay, isa ka sauce, isa ka ingredients nga wala namo naa sa ako ang mga staff. So it is a concerted effort for everyone. During my time when I had my Philippine Command and General Staff course in Camp Aguinaldo for 10 months, I had my studies there. And the Command and General Staff course is the most elite academic study in the whole world. I knew about the Bayanihan Act. I read the article and I told myself, this is impossible. But you know, media, you are aware that Bayanihan Act during the pandemic is working. That Bayanihan Act was signed by our President, Rodrigo Roa Duterte, that we must act as one. We have to collaborate. We have to have a stakeholders engagement between private and government facilities in order to save the lives of the Filipino people. And it was given a craft, it was given a cornerstone during the pandemic that all morbid patients died.
One TV special report.